sharing with you information about Down syndrome and how to find out if your child potentially has it. The topics that we will cover are the signs, relevance, types, risk factors, diagnostic tests, and treatment for Down syndrome. If you suspect that your child may have Down syndrome or will be genetically predisposed to it, we will also talk about resources in the community that can assist your family in the management of it.
Down syndrome is defined as an extra pair of chromosome 21, also known as trisomy. This occurs in babies who are genetically predisposed to the disease and alters the way their body and brain develop. Down syndrome is unique to each individual's capabilities.
Children with Down syndrome normally appear with a flattened face at the bridge of the nose, almond-shaped eyes that are slanted upwards, a short neck, small ears, hands, or feet. Their tongue normally sticks out of their mouth. There could be small white spots on the iris of their eye, or a single line across the palm of their hand known as a palmar crease. They could also have poor muscle tone or loose joints and are shorter than most other children and adults. Health-related characteristics of Down syndrome include loss of hearing, sleep apnea, ear infections, eye diseases, and heart defects.
When recognizing Down syndrome in children, things that you need to look for are slower rate of growth, low muscle tone, digestive issues, delays in speech, problems with self-care skills like eating or using the bathroom. They can also have problems with learning and will take longer to reach developmental milestones. 6,000 babies are born a year with Down syndrome. That is 1 in every 700 babies.
There are 3 types of Down syndrome. The first one is called trisomy 21. This one is the most common type of Down syndrome, where each cell in the body has 3 copies instead of the usual 2. Then there's translocation Down syndrome. This is when an extra chromosome or part of it is attached to a different chromosome instead of being separate. The last type is mosaic Down syndrome. In this one, some cells that have 3 copies and then some have 2. They show fewer signs of the condition because a portion of their cells are normal.
There is no evidence to show why Down syndrome occurs, but one risk factor that increases the chance for a baby to be born with Down syndrome is if the mother becomes pregnant after the age of 35.
There are 2 ways to test for Down syndrome, either screening tests or diagnostic tests. For screening tests, they determine the chance of Down syndrome in the pregnancy. It's a safer test, but doesn't give a definite result. These kinds of tests include a blood test and ultrasound, where the clinician looks for extra fluid behind the baby's neck as a sign of a potential risk. Then there's diagnostic tests. These are more risky, but they give a more accurate prediction of Down syndrome. These include chorionic villus sampling, which examines material from the placenta, amniocentesis, which examines amniotic fluid, or percutaneous umbilical sampling, which examines blood from the umbilical cord. These tests look for changes in chromosomes. There's also diagnostic tests for when after the baby is born. These include the rapid blood test, aka FISH or karyotype blood test, which diagnose what type of Down syndrome.
Treating Down syndrome early helps with improvement of the child's physical and intellectual abilities. It also has a positive impact on their learning and development. Services include therapy for speech, such as communication and self-expression, occupational therapy for motor skills and sensory inputs, behavior therapy, managing emotional and behavioral problems, and physical therapy for increase in mobility, muscle strength, and function. There's also school programs for children and young adults from ages 3 to 21 that can get educational support through their public school system. Half of the babies with Down syndrome are born with congenital heart defects. More severe cases are treated by cardiologists with medication or surgeries. Other health issues that may need to be treated are seizures, hyperthyroidism, leukemia, and neck abnormalities.
There are multiple resources in the Tampa Bay community that you can contact if you have more questions or need services for your child. These facilities are the National Down Syndrome Congress, the Association for Children with Down Syndrome, the Global Down Syndrome Foundation, local parent support groups at the Down Syndrome Association of Central Florida, and Friends Support Incorporation, Tampa. Refer to the brochure for their contact information.
Now we will demonstrate an exercise that will help assess your child's tone. It will also assist in strengthening functional skills that will assist in eating using a D1 flexion PNF pattern.
The first thing we're going to do is assess your child's muscle tone. Tone is the natural resting resistance that the muscle has. If they have a lot of tone, it's going to feel kind of stiff and it'll be stronger. If they have low tone, which is a sign of Down syndrome, it's going to be weaker and there won't be a stiff muscle bulk. So, the passive range of motion that we're going to do is elbow flexion, because that's what happens when they feed themselves or put a fork or spoon to their mouth. So this is going to be passive, meaning that you're doing it and you're telling them to rest. Signs that you're looking for are hypotonia, which means decreased muscle tone, decreased strength, or hyperflexibility, which means their range of motion goes past what the normal endpoint would be for elbow flexion. Now to work on the strengthening for this functional skill of eating, you're going to do a D1 flexion pattern that looks like this. It goes up across the body, you supinate the hand, which looks like this, you turn it towards you, and then you bring it back down eccentrically. First you're going to do it passively, which means that you're doing all the work. You're going to have them reach across, supinate, bring it back down. The next progression would be active assisted, which means that your child would help you out as you also bring their arm through the motion. So bring it up, help me out, lift, lift. And during that phase you can also assess muscle tone. Children with Down syndrome will be weaker. Then the next progression would be actively by themselves, so you're not helping out and you just ask them to raise their arm, bring it over their chest, and turn their wrist inwards towards their body. Bring it back down, slow and controlled. And the last progression would be adding resistance. So you're going to have them do the motion, and you're going to resist. Pull, pull, pull. Good. And you can resist all the way down. Push, push, push. Perfect. Now that you know how to perform passive range of motion and PNF D1 flexion patterns, go ahead and try that with your child to assess them and help them regain strength and functional skills for eating. So to conclude, if you suspect that your child may have Down syndrome or be predisposed to it, you know the signs and symptoms to look for now, and reach out to someone in your community. The resources that we listed, all of those facilities will be more than happy to help you.